I'm Kaylee Fowler, and this is my informative speech. Imagine seeking help for a mental health condition only to feel more judgment, feel unsafe, or possibly even re-traumatized by the very system that was meant to support you. Imagine desiring a better life, knowing the steps to take to get there, but being shut down by those designed to help you. Post-traumatic stress disorder affects millions of people, and the way mental health professionals react or respond is absolutely paramount to the healing of the individual. If the provider reacts negatively to their treatment, will be hindered. But if they react to the correct way and provide support, it would be astronomically aid their treatment within PTSD. As a college student studying health science with a strong interest in trauma and mental health, I have researched using evidence-based practice that have improved health outcomes for individuals with PTSD in the past. My research shows the following. Trauma-informed care, also known as TIC for short, is an essential approach for supporting individuals with PTSD because it ensures their safety, empowerment, and the ability to understand the long-term impact of their trauma and how it affects them. A patient cannot heal unless they absolutely understand their conditions. To start off with, I will explain what trauma-informed care is and how it relates to PTSD. To continue, I will discuss the core principles, and lastly, I will describe how trauma-informed care improves outcomes for people with PTSD. Trauma-informed care is an approach that recognizes and understands the widespread impact of trauma in the world and understands how trauma influences behavior, health, and recovery throughout the life of the individual. According to the Substance and Mental Health Services Administration, trauma-informed care emphasizes understanding trauma rather than asking what is wrong with the patient focus. For example, individuals with PTSD may display avoidance, hypervigilance, or emotional numbing, which are adaptive responses to the past trauma rather than reflecting themselves. Research shows that the traditional care models that ignore the trauma unintentionally re-traumatize patients and worsen their symptoms. Trauma-informed care directly addresses PTSD by acknowledging trauma as a major factor in health. PTSD is linked to changes in the brain's stress response system, including the amygdala and the prefrontal cortex. Understanding these changes allows providers to respond with empathy instead of punishment or disbelief, or even what trauma-informed care is provides a foundation for examining the principles that guide this approach. Trauma-informed care is guided by the core principles that promote healing and prevent possible re-traumatization. One of the main core principles of TIC is safety, which includes both physical and emotional safety. For individuals with PTSD, feeling physically safe and emotionally respected is essential by reducing anxiety and fear responses. Simple actions such as explaining procedures in advance can help restore a sense of control. Another key principle of trauma-informed care is empowerment, voice, and choice. Allowing individuals to make decisions about their care helps counteract the loss of control often experienced during trauma. Studies show that large empowerment increases engagement in treatment and provides long-term recovery outcomes. By applying these principles, TIC care creates an environment that supports healing rather than harm. Trauma-informed care leads to better outcomes for individuals with post-traumatic stress disorder. Trauma-informed care improves the trust between the individual's PTSD and the health care or support professionals. When people feel understood and respected, they are more likely to seek help and remain in treatment. Improved trust has been linked to lower dropout rates in mental health services. Trauma-informed care supports long-term recovery and personal resilience. By reducing re-traumatization, individuals experience fewer symptom flare-ups and improve emotional regulation. Trauma-informed environments also benefit providers by reducing burnout and increasing compassion and satisfaction. Overall, trauma-informed care creates conditions that allow individuals with PTSD to heal more effectively. In conclusion, trauma informed care plays a vital role in supporting individuals with post-traumatic stress disorder. Today, we will have seen that trauma-informed care is essential because it prioritizes safety, empowerment, and understanding the lasting effects of trauma. First, trauma-informed care recognized how trauma impacts the individuals with PTSD. Secondly, trauma-informed care is guided by the principles such as safety and empowerment. And finally, trauma-informed care proves trust, treatment, outcome, and long-term recovery. Just as the wrong response can deepen harm, a trauma-informed approach can transform care into a powerful source of healing for individuals living with PTSD. Thank you very much.